I'm Chris Sarlis. I am the Director of the Health Campaign Effectiveness Coalition, and on behalf of the Coalition and the Task Force for Global Health, I want to welcome you to today's webinar. It's great to have so many colleagues join us today to learn about the Collaborative Action Strategy for Campaign Effectiveness, or CAS as we call it. I know many of you have been engaged with the HCE Coalition in numerous ways over the past 5 years. I see quite a lot of familiar names on the registration. We're very pleased to have your ongoing interest and collaboration today, and a very big welcome to those of you who are joining for the first time. Please go ahead and use the chat to introduce yourselves and to tell us where you're joining from. So if we can pull up the agenda for today, we have planned a very engaging and interactive discussion today. I'll begin with an overview of the HCE Coalition's Collaborative Action Strategy and highlight some key milestones and progress to date. Next, I'll be followed by a few remarks from the chair of our leadership team. In addition, we're very honored to hear messages from 2 other members of our leadership team, the Executive Director for Nigeria's National Primary Healthcare Development Agency and the State Minister for Health Services and Programs at the Federal Ministry of Health in Ethiopia. They are leading efforts on the CAS in their respective countries. Senior members from Nigeria and Ethiopia will then present their updates as well as engage in a very interactive panel discussion. And then, of course, we have planned time for Q&A with the audience and ask you to feel free to submit questions using the Zoom Q&A function on the tools section throughout the webinar, and we'll try to answer many questions as we can. Finally, before we close, we'll provide you with a quick tour of our new CAS tools and knowledge products that are available on our website. So what is the Collaborative Action Strategy, and why and how did we develop it? The CAS is the Coalition's 5-year strategy, and it's designed to guide global health organizations, partner programs, and governments to a future state where health campaigns collaborate effectively with each other and with corresponding health services to maximize impact and efficiency. The CAS was developed in 2023 by more than 50 global, regional, and country-level experts representing various governments, organizations, funders, and implementers across all the major campaign domain programs, including those from vaccine preventable diseases, NTDs, malaria, and nutrition, and was approved by our leadership team in December of 2023. The recommendations included in the CAS are grounded in credible evidence and best practices, many of which were identified through the Coalition's learning events and implementation research studies. And you can access all the reports and summaries from these earlier studies on our website's knowledge base section. When developing the CAS, we strive to align its purpose and recommendations to complement existing disease-specific guidance, such as the Immunization Agenda 2030, the NTD Roadmap 2030, and different strategy documents for malaria, polio, and nutrition. And you can access and download the full strategy on our website, and we'll provide a link in the chat. The CAS is intended to be adaptable and customizable strategy. It includes 12 recommendations that address areas around campaign planning and implementation, monitoring, evaluation, research, learning, and adaptation, or what we refer to as MERLA, and campaign financing. The strategy document also includes many suggestions for stakeholders on how to actually implement the recommendations. But because the recommendations are generalizable, they can be customized to fit each country's unique priorities and contexts, and we'll hear about that soon from Nigeria and Ethiopia and how they did this. The CAS was designed to strengthen both individual disease programs and the overall health system, and we believe that this cross-campaign and program collaboration is absolutely essential given our current funding landscape. This next slide summarizes the 12 recommendations in the strategy, and again, a lot more details on each of these can be found in the full CAS document. If you look in the first column, this lists the 5 recommendations related to campaign planning and implementation. These include establishing or leveraging an existing national coordinating body or a steering committee that will govern and lead the country's campaign strategy. There are recommendations that ask programs to work together to identify which campaigns and domains are suitable for best suitable for collaboration or integration, and then to develop a shared campaign schedule or calendar. There are also recommendations related to harmonizing tools and operations and developing a coordinated and effective approaches to community engagement. 3 of the recommendations are related to MERLA, as depicted in the middle column. The first 2 recommendations are aimed at the country level and include developing a cross-campaign MERLA strategy and improving the ability of the Ministry of Health and various implementing partners to use and share data on campaign effectiveness. The third recommendation is being led at the global level and calls for the development of a learning platform and guidance that can support countries and partner organizations when measuring various outcomes around campaign effectiveness and integration. And our MERLA task team will be developing draft guidance on this just this year. In the third column, you'll see 4 recommendations that pertain to campaign financing. These include creating a comprehensive view of campaign financing at the country level, harmonizing and aligning campaign financing and incentive modalities, and advancing the government's role in campaign financing. To align on expected outcomes, the CAS theory of change was developed by a MERLA task team. We have identified a number of mid and long-term outcomes that should occur at various levels of the health system once the CAS is fully implemented. You can see sort of in the first column there, at the global and regional level, successful implementation of the CAS will require partner organizations and donors to adopt new ways of working together to better support countries as they work to implement more collaborative and integrated campaigns. This should also lead to changes in the way that campaigns are financed and the development of other supportive policies and normative guidance in the coming years. At the country level, in the middle column, in addition to more coordinated and effective campaigns, implementing the CAS should address inequities in frontline health worker payments and provide incentives for harmonized and integrated approaches that result in improved efficiency and coverage. And to ensure sustainability, countries will also work to integrate and align their CAS recommendations into their own national policies, annual plans, and budgets. Over time, we also anticipate that other countries, in addition to Nigeria and Ethiopia, will adapt the CAS, since many are already acting on several of the recommendations. And in the last column, and you can see, in order to facilitate these changes, the HCE Coalition is supporting a learning agenda and monitoring progress against these outcomes. We plan to identify promising and evidence-based practices in the coming years that can be adopted and adapted for others to use. We're also collecting baseline data on several of these outcomes in the coming months and will monitor their progress over time. The Coalition's leadership team recommended using a phased approach to implement the CAS. This first phase began last year in January 2025 when we launched, 2024, when we launched the CAS at a meeting in Addis Ababa. During this meeting, we were joined by our leadership team and representatives from the Ministries of Health in Nigeria and Ethiopia, who both opted in to be the first countries to implement the CAS. We consider these first few years a proof of concept or demonstration phase where with the CAS, where we'll begin to focus on learning and adapting before going to scale in the latter years. We feel it's essential to learn about the decision-making process that countries undertake when implementing the CAS. And by early next year, we should have some findings that demonstrate the outcomes and value of cross-campaign collaboration. This year, we'll also be monitoring how changes at the country level can be a catalyst for initiating policy change at the global level. And by the end of this year, we will explore approaches to introduce the CAS recommendations to other countries and to assess opportunities to ensure changes in the focus countries are sustained over time. And next year, based on the learnings and achievement of outcomes from our focus countries, we'll assess progress and identify potential pathways to expand and scale up CAS recommendations during a second phase. I'm very pleased to say that in just 1 year, significant progress has been made by Ethiopia and Nigeria. Each country embarked on a very intentional planning process. To begin with, each country spent considerable time socializing the CAS to their stakeholders and gathering their interest and input on the feasibility of adopting the CAS. This helped them identify both the opportunities and the potential risks to implementing CAS recommendations and to ensure full partner buy-in before moving forward. They then used this information to bring their partners together through a highly collaborative process to customize the CAS recommendations and develop detailed implementation plans. They also started implementing several of the recommendations, especially the first ones that call for forming a campaign steering committee, developing a shared campaign calendar, and identifying integration opportunities. From this experience, several success factors emerged. Most importantly is having full government ownership and leadership at the highest levels. Recall that adopting the CAS is voluntary and is not a specific donor-funded initiative. You will soon hear from Dr. Mui and Dr. Derajay on their commitment to leading this change in their countries. Secondly, is to ensure that the customized CAS recommendations align to the national government's priorities and that they support achievement of their health sector goals. This is the only way that changes can be sustained over time. A third success factor is the need to build strong and broad stakeholder engagement from the beginning. The amount of coordination and effort to bring together so many partners and perspectives into CAS customization and planning process is not to be underestimated. Gaining consensus on campaign priorities and plans across multiple agencies and programs takes time. It requires leadership, dedication, and support from multiple partners. And you'll hear more about this process in the upcoming country presentations and the discussion. I would like to close by noting several opportunities for you as our coalition members to support the CAS this year. We hope that after this webinar, you will become champions for the CAS. I think we're on the next slide, please. Back one. That's okay. After this webinar, you'll become champions for the collaborative action strategy and will help socialize it with your colleagues and partners. You may have already engaged with one of the focus countries, so please continue to participate and support them during this initial phase of the CAS implementation. At the end of the webinar, we'll share some new knowledge products that can be used by countries interested in adopting the CAS. Please help disseminate these resources to your own networks. We're all eager to learn how and to what extent campaign collaboration and integration can make a difference. Partner with us in this learning process and also in supporting Nigeria and Ethiopia as they strive to monitor, evaluate, and document and measure change. And finally, we know that collaborating across programs and integrating campaigns isn't easy. As I've noted several times, it takes incredible leadership and full partner commitment. But the changes will only be sustained if we also address some of the systemic barriers that prevent us from working effectively together. We are a coalition of diverse partners whose collective voices can make a difference. Join us as advocates in breaking down our programmatic silos and work with us to identify and drive a change agenda this year. Thank you very much, and I would like to next introduce Dr. Hamid Jafari, the Director of Polio Eradication for WHO's EMRO region and Chair of our HCE leadership team. He will say a few remarks before we hear from our country colleagues. Thank you. Over to you, Hamid.
Thank you, Chris, for an excellent overview. And I also want to extend a warm welcome to all the participants. Our coalition constituency. So it's a real pleasure for me to be able to speak to you. And I'm just going to make very brief remarks because I think there is a couple of very rich presentations from countries that you will hear. I think the first thing I want to say is that this collaborative action strategy has been built on really literally multiple years of research, discussions of various scientific and public health groups who came together to do the first phase of learning, and then extensive consultation that led to across the leadership team, across the coalition members, to come up with this strategy. So it's very well thought out. It's very well designed. It's really been thoroughly vetted. And it, of course, brings, and my second point is that it brings enormous value proposition of how we can be more effective in integrating and coordinating multiple health campaigns that actually fragment health systems and don't really take advantage of the combined forces and assets of various large global health programs that could be aligned and could be a force multiplier for public health impact. So I think the value proposition is enormous. And given now what is happening in with the withdrawal of US government funding, we expect that this will have enormous secondary effects as well, given the global political development. Perhaps the funding space is going to shrink even further. And in that scenario, the value of this integrated approach of collaboration across different health programs in how they implement health campaigns becomes even more critical and important. And for us to actually come together as a coalition at this time and work with countries is extremely important. And then finally, I just really want to emphasize the importance and value of the implementation that has started in the two focus countries, Ethiopia and Nigeria. And first of all, I want to really thank the leadership in those two countries for fully embracing this strategy, adapting it to their context, and take this forward. And the progress, as you saw, has been very, very impressive. And so I think it is very important that what we learn from these two countries as they lead the way and how we gather around this implementation in these two countries is really going to chart the way forward for us to be able to fully realize the value of this of combining and really integrating the various health campaigns to maximize their value. So again, once again, a warm welcome to all of you, and I'm going to hand it back to Alison. Are you moderating? Back to you, Alison. Thank you.
Thank you so much, Hamid. Yes, it's my turn at the mic. Welcome, everyone, and thank you for your participation. And again, thank you to our leadership team chair, Dr. Hamid Jafari. Thank you for your remarks. And kind of reiterating the importance and the opportunity that we have this year. I'm excited to tee things up for some pre-recorded presentations from our focus country focal points and leaders. So I'll introduce them. We'll watch some pre-recorded remarks and presentations. And following that, we'll open for a dialogue with the panelists and turn to Q&A from all of you. So as your questions come up, listening to these presentations, please add those to the Q&A box or the chat. We'll be keeping an eye on those. And then as we get into our more interactive portion of the agenda after the presentations, we'll turn to your questions. So you will hear now from representatives from Nigeria, Dr. Muyiana, the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency, Dr. Hassan Shehu Usman, Head of Non-Polio SIAs at the National Primary Healthcare Development Agency, and Ms. Sayanatu Abukar Umar, Technical Assistant to the Coordinating Minister for Health and Social Welfare at the Nigeria Federal Ministry of Health. Immediately following our representatives from Nigeria, you'll also hear from two representatives from Ethiopia, His Excellency Dr. Dereje Duguma, State Minister for Health Services and Programs from the Federal Ministry of Health, and Dr. Lilisa Emmanuel, Senior Advisor to the State Minister at the Federal Ministry of Health. I'll turn it over to my colleagues to tee up these presentations, and we'll look for your commentary and questions in the chat and Q&A. Thank you.
Good morning and greetings from Abuja, Nigeria. My name is Dr. Muyi Aina, and I am the Executive Director of the National Primary Healthcare Development Agency in Nigeria. In my role, I run the organization that is responsible for delivery coordination and delivery of primary healthcare to Nigerians, which is inclusive of immunization and especially both routine immunization and campaigns. I bring greetings from the minister, and it's really a pleasure to be here today. On behalf of the government of Nigeria, I'd like to really just express our thanks to the leadership of the Collaborative Action Strategy, not just for the engagement and the support that we have had since we kicked off last year, but also for the learnings that is coming our way from the collaboration. I speak for myself. I'm the co-chair, Dr. Ntadom, who's the Director of Public Health at the Federal Ministry of Health and Social Welfare, and the Coordinating Minister for Health as well, Professor Mohamed Ali Pate. I recognize the HCE leadership team for the invaluable technical guidance that you're giving us, but also for steering the country-level strategies. I think a lot of the adoption of the framework has guided what we are doing to try to improve the quality and outcomes of our campaigns in Nigeria. Since we kicked off the CAS in Nigeria, we have done a number of things. One notable one is a workshop that we did to bring all of our campaign stakeholders together to really understand what are the bottlenecks and come up with specific reforms that will improve the quality of all health campaigns in Nigeria. And we landed on things around accountability across board for the government at all different levels, the federal, the state, and the local government levels, but also for our partners as well who are implementing this, as well as the donors and those are partners that are responsible for commodities and supplies, just to make sure that we're all working in sync. We looked at reforming the way we select our vaccinators and to make sure they are qualified people, they can be well trained, and they can be held accountable for the quality and integrity of the activities that they implement. We also looked at our advocacy and communications, and what we landed on was the need to have tailored, community-driven approaches that speaks to the specific barriers within the different communities. Nigeria remains firmly committed to the CAS, and we align with it because it's very much in sync with our country's health campaign strategy and vision and the direction that we're going. So the priorities that NPHCDA and our other health MDEs institutions are focusing on really reflect this. Before I close, I'd like to thank His Excellency the Honorable Minister of State for Health in Ethiopia, who's also our pilot country, for the collaboration and the cross learning, and look forward to pushing forward with the learnings from this webinar through the technical working group that we have established in Nigeria. Thank you.
Hello, everyone. My name is Zayanat Abakar Umar. I'm a technical assistant to the Coordinating Minister of Health and Social Welfare. I also lead the HRH component of the SWAP Coordinating Office, and part of my schedule is the focal point for the Collaborative Action Strategy in Nigeria. And so we're delving into YCAS, the strategic blueprint that was part of the Renewed Hope agenda of President Bola Tinubu, has redesigned a framework that focuses on effective, equitable, and quality health systems, as well as health security and effective governance, amongst others. And top burner for this is in terms of delivering health to improve the lives of the citizens of Nigeria, reducing physical and financial pain, and ensuring quality health for all through accountability, ensuring the quality of services reach where they reach to the points where they need to be. And Nigeria committed to the CAS as in terms of alignment with this strategy because there's already political commitment through this decision makers at all levels, prioritizing fewer and more efficient campaigns with efficient use of resources. In terms of institutional knowledge, there's extensive history of the integration efforts that provide a strong foundation for leveraging the CAS. And then there's the near-term momentum in terms of intra and interdepartmental norms that are evolving from the SWAP adoption and of course the NPCD's 2024 internal campaign coordination initiatives. We are talking about the lack of communication, the need for better synergy between the Federal Ministry of Health and NPCD that are in the front burner when it comes to campaigns in Nigeria. A lot of the times we have been working in silos. Collaboration and disincentivization in terms of siloed structures and inconsistent per diem practices that leave some of the programs at the mercy of others. And of course, there's the bandwidth for constraints with the health systems that have been overburdened in terms of the health workers always being on the field rather than attending to their primary responsibilities at the healthcare centers. So how has CAS been adopted in Nigeria? Following the launch that was in January 2024, there have been major strides, which include the development of a collaborative action strategy guideline that serves the domestic needs of Nigeria. We looked at the guideline and we were able to develop it to suit the needs in country. This was following the inauguration of a technical working group that is being co-chaired by the EDNP-CDA and the Director of Public Health to bring about the synergy that is much needed between the Federal Ministry of Health and the National Primary Healthcare Development Agency, which are the top burners, like I mentioned, in terms of campaigns. The TWG has subgroups in terms of planning and implementation, Merla M&E, and financing. And towards the end of last year, we were able to build implementation plan for the NCAS, including detailed implementation tasks with roles and responsibilities for persons, timelines, and costs also being established. The campaign integration opportunities were also mapped using a specific matrix, and we closed off the year with plans for 2025 to actually begin implementation. So 2024 was more of a year of planning and sensitization and kind of engaging on the CAS. By 2025, we would begin the real work in terms of CAS. There have been major lessons learned, especially with Nigeria as the pilot country for the collaborative action strategy. We've literally been building the boat as we go, but we can say for sure that there have been the establishment of clear focal points in the Ministry of Health and the NPHCD has been a key factor for success in terms of coordination and implementation. The establishment of the heads of the agency and the head of the Federal Ministry of Health that is relevant to this, that is the Director of Public Health and the EDNP-CD co-chairing this this strategy has been crucial in terms of sustaining a political will. And the fact that we kicked off with in-person workshops and facilitations was an effective means of socialization at the different levels. We also established a readiness assessment that created the baseline for what is actually on ground so that we know where we're taking off from and what we can use to measure in terms of tracking the progress and where we need to sit back and realign. What are the key changes that have been established since the CAS implementation? So CAS principles are starting to be embedded in upcoming campaigns. This is something we're very, very happy about. At every stage for each of the disease programs, there is mention of CAS. There was a meeting earlier this year where the NPHCD was trying to actually study the health campaign effectiveness in terms of the NPHCD space with the polio and non-polio SIAs to improve on the campaign opportunities and to also see through what areas they could further collaborate with the disease programs from the Ministry of Health side of things. Then collaboration and integration has become a growing priority with the NTDs actually launching the NTDD with the mention of the CAS as the next way to go in terms of campaigns for NTDs and malaria, hopefully. So I'll hand over to my colleague, Mr. Shio Hassan from the NPHCD to take on the next couple of slides. Thank you.
Okay, thank you, Zaya. Yes, my name is Hassan Sheikh Usman. I work with NPHCD, that is the National Primary Care Development Agency. I am the head of non-polio SIA and also a focal point for the HC, that's the CAS. So I work in collaboration with the Federal Ministry of Health and the CAS, the focal point there. Yes, last year was kind of planning for the CAS implementation, while this year is for the real implementation. So these are the anticipated 2025 CAS timeline in Nigeria. For the first quarter is the formalization of NCAS. That is NCAS formally launched and national coordination body established. Then also to pilot campaign for integration identify, the financing and policy solution for integrated health campaign prioritize. So in quarter 2, we are looking at the tool harmonization, that is a coordinated MALA framework and funding strategy formalized, and also common tools harmonized. For quarter 3, we are looking at the initiation, that is the state level coordinating body established, then CAS-led integrated campaign conducted, and also finance harmonization framework formally agreed upon. While in quarter 4, we are looking at the acceleration, that is CAS practices integrated into a campaign, then campaign selected for transition into the PHC system. So in 2026, we start the monitoring and scale up, that is the regular campaign report published, and also CAS practice assess and also refine. So as said by my colleagues, the team have been able to map all the campaign for 2025 in country, and also working with together to also identify which campaign can be implemented together. In the Federal Ministry of Health, that will be through the MOH integration meeting in March this year. So these are the campaign that we conducted in 2025. In January, we have the World NTD Day, while in February, there's going to be MOH campaign alignment. For February, as the NPHCD as an agency called for a dissolution meeting where all partners, the donors, the Federal Ministry of Health, all involved in a campaign ecosystem were invited. So the workshop focused on the immunization campaign, that is the polio and non-polio campaign. And what we look at the workshop, the objective is to identify some issues or challenges and how solution can be provided for us to have a more effective campaign. And about 6 of these were identified, ranging from the team selection, supervision, localization of ACSM, single database, and also integrating the polio and non-polio, which you can see they are all embedded in the CAS recommendation. So in March, we are having malaria campaign, that is a micro planning. In April, there will be polio, that is vaccine week, there will be polio campaign and also ITN malaria campaign. While in May, we are going to have the HLF campaign, the malaria SMC campaign, integrated immunization campaign, and also the first round of polio campaign. So in July, June is a mark for MSH week, while in July there will be malaria campaign. In September, there will be polio campaign and also malaria campaign. So in October, that is the when we plan to integrate the non-polio campaign and polio, because we have the measles rubella catch-up campaign this year, and also we are going to have a round of polio campaign in October. So already we've started working together right from planning. We're planning together to see that this campaign are integrated right from planning up to the post-implementation stage. So in November, there will be MNCH week, and also integrated immunization campaign. So this is what we have for this year. For the NTD campaign, they are not included now at the timeline because the date has not been finalized. But we are able to realize that for long-term CAS success, it will require budget, people, and voice. So we're looking forward for all the donor and partners for support so that we can achieve the objective of CAS.
Good morning, everyone. Greetings from Addis Ababa, Ethiopia. This is Dr. Daraja Duguma, State Minister for Ministry of Health. First of all, thank you very much to have us in this important meeting that we address virtually the progress of health campaign effectiveness and specifically the CAS strategy progress in Ethiopia. So first of all, health campaign effectiveness initiative is one of the most important initiatives that we have been working with our partners in terms of bringing up stakeholders that support us around this campaign, and we have made it one of the strategic areas that we focus on the ministry. So in terms of the CAS progress, first of all, we have conducted feasibility assessments, and the team have supported us in terms of going down to the facility level, to the regional area, to assess the feasibility of this CAS and in general this campaign effectiveness. And we found that at every level, all the leadership has welcomed this important initiative. And the result of this feasibility assessment have been disseminated, and we have agreed on what are the status at the ground, what we need to work more, and what's all about the initiative. And then we have identified key stakeholders from the government, from different sectors, and also from the departments in the ministry, and also at regional level. Specifically, donors and implementing partners have been part of this important movement in Ethiopia. And then we have tried to socialize the CAS to the ministry staff and also for the regional counterparts, and we are working still on the socialization of CAS. Lessons learned in Ethiopia, we have some background, actually, we have some examples where we were able to integrate our campaigns that have been, lessons have been learned, and also we have customized our CAS based on the learnings that we got from different countries in Africa and also beyond. That's also one important step that has been taken in the ministry. And actually, in terms of governance and the coordination, National Steering Committee have been established, and I myself chaired that steering committee. The key stakeholders, including partners and donors, are part of this steering committee. And actually, under the steering committee, we have established 3 technical working groups which are very active, and they meet frequently, and they have been discussing on the progress in general. These technical working groups, one focus on planning and on implementation, and the second working group focuses on learning and also the financial aspect, and the last one focuses on policy formulations. And one important departure after we started the health campaign effectiveness is the CAS strategy has been endorsed, so that's one important thing. And then we have mapped our campaigns, and the campaign calendar have been set out. So we have 4, we have planned to have 4 integrated campaigns that will bring all the activities and different health campaigns into those specific calendars. Actually, we have a costed implementation plan, and we'll roll out this implementation plan going forward. And one important endeavor was engaging our regional counterparts. As is known, Ethiopia is a federal state. Regional health bureaus and regional government has their own mandate. They are mandated to have their own specific roles, and especially in terms of campaign, they are responsible to do the campaign in facilities in their constituencies. So the regional rollouts is also going very well. They are very aware of it. We have different meetings with the regional counterparts. And finally, we have almost over the last 7 months since we have started this CAS strategy, we are able to integrate our campaign. For example, last time we have NOPV2 campaign, and before that we have zero dose clearance campaign, which is called Kind initiative. We have included a number of initiatives like Gulf Foods, malaria prevention activities, nutrition-related activities. So, I mean, we have already started the implementation of the strategy, but going forward, especially we have upcoming measles immunization campaign, which will be conducted after a couple of months, and we have a number of initiatives that we have planned to integrate into this big campaign. Finally, thank you very much to have us in this important platform, and going forward, we will all commit, especially as a ministry, to fully implement this strategy. Thank you very much.
Hello everyone, this is Ledisa Manuel. I am the Senior Advisor to the State Minister and the National CAS Coordinator in Ethiopia. Today I will briefly present the Ethiopian Health Campaign Effectiveness moving from foundation to the implementation. So as a country, before presenting what we have done, I will present the outline of the presentation, so which includes the Ethiopian CAS introduction and progress, selected health campaigns, integration opportunities, early results, next priority, and ECAS support areas we need from the global partners and also from our own. So just to start by introducing Ethiopia, though it is origin of mankind, everyone hopefully knows Ethiopia, but the administrative structure, there are 120 million population in Ethiopia with area of 1.1 million kilometers, and it is divided into 12 regions and 117 zones, 2 city administration and like 1,063 waradas. These are the administrative structure. So the warada is where we consider it is a small administrative region. Also in Ethiopia, 77% of the community is rural dweller, the rest are urban dweller. So coming to ECAS progress, as a country, the moment we heard about CAS, we were initially focusing to bring most of the activities together. But coming to this initiative, Ethiopia opted out to implement this CAS thanks to our state minister who from the very beginning participated on the decision. So the Ethiopia opted out and the Minister of Health endorsed the CAS strategy. Then we step to do the feasibility assessment, and the result of this feasibility assessment is disseminated into different medias nationally and globally. Following that, we focused on the identification of the stakeholders from the donors, implementing partners, and also government stakeholders. Once we identified that, we did the CAS socialization workshop. In that socialization workshop, all stakeholders we consider highly important were part of it. And once we did that socialization, the National Steering Committee is formed there. So this National Steering Committee is led by His Excellency Dr. Dereje, the State Minister, and all donor organization leaders are part of it. Under this steering committee, the National Technical Working Group is identified. So in that National Technical Working Group is led by myself as a senior advisor to the State Minister. He directly appointed me as a National CAS Coordinator and also to organize this steering committee, member of the steering committee, and as a technical working group. Then we as a technical working group, we start to focus on global recommendation, and we customize that to the national level. Once we did that, we identified the campaign calendars, especially for 2025-26. We identified the nationally the campaign calendars. Then national CAS strategy is also developed. The CAS implementation plan developed and endorsed. Regional CAS rollout and implementation guideline is ongoing. We are working on it, and in the very near future, we will finalize and share it to the global community. So preparation compiled for measles with nutrition for the upcoming May 2025 campaigns. So this measles campaign will cover the house-to-house work, so that will be part of our next plan. So we customized recommendation to enhance campaign and coordination in Ethiopia. So accordingly, we have in the technical working group, we divided the technical working group into 3 parts: planning and implementation, MERLA, and campaign financing team. So these are adopted from the global one, but nationally we have those teams. We also identified the campaign list and integration in Ethiopia. So as this slide shows, we have included immunization, nutrition, malaria, NCD, and NTD. These 5 areas are.
So thank you to all of the collaborative action strategy focus country teams and the leaders for those remarks and updates. There's a lot of information to cover. A lot of ground was covered in the last year. And now we have an opportunity to probe a bit deeper into some of the successes, key findings and learnings, opportunities, challenges, etc. And then really importantly, start to envision success for the new year. I'd like to introduce our moderator for this discussion, Abdu Adamu from the World Health Organization Regional Office for Africa. Abdu is also the chair of the HC Coalition MERLA Task Team. Thank you, Abdu, for your support. I'll turn it over to you for a discussion with the panelists, and I'll also encourage folks to add any questions you are having as you've seen the videos and the presentations, and as you're listening to the panelist discussion, add those to the Q&A box or the chat. We're keeping an eye on those. Abdu, over to you.
Thank you very much, Ali. Can you hear me well?
We can, thank you.
Oh, great, and good day, everyone. So for this panel discussion, we will dive deeper into the CAS journey so far. Our discussion will focus on key aspects such as stakeholder engagement, some of the challenges with implementation, and adaptation strategies. And we invite our panelists to share their insights. Our panelists are very experienced. They've been on the CAS journey right from the beginning, and we also encourage all participants to engage actively by sharing thoughts, questions in the chat box, and we'll have time later on to go over them, some of those key questions and answer. So all panelists are set. Yes. So let me start with our colleagues from Ethiopia. The question I would like to ask is, what has been the most effective method for engaging diverse stakeholders? Because CAS involves stakeholders from Ministry of Health, from donor agencies, for implementation partners. And we just want to hear from you some of those methods that we've used to engage the stakeholders.
Thank you very much. So initially, in the office, we discussed with the state minister the importance of this CAS, and we all agreed in one sound. It is very important. We addressed this initiative to our donors through a letter from the state minister. So he sent the letter and he called a meeting So in the first meeting with the stakeholders, he addressed that question and the initiative. So most of them agreed, and we wanted to socialize and discuss on this issue. So on that socialization, the Ethiopian government cover all the costs and call all stakeholders into a hotel, including donors and implementing partners, including the region ones. So everyone was happy because this undertaking was so important for each of them, and they are also happy that it is honored by the Ministry of Health. So that is the main reason everyone is part of it. So every time we call a meeting, either it is a steering committee or technical working group, almost all partners are part of the meeting. So if you can see my slides in all stakeholders meeting, you can see the pictures, and some of the team came from US, Nigeria. You have seen the participation of all participants. So that is, the main reason is it is owned by the senior officials, especially it's part of the government system. If I answer you, it's okay. Otherwise, we can receive further question. Over
Yes,
to you.
thank you so much, Lelisa. So let me turn to our colleagues from Nigeria, Zaya and Shehu. Let's also hear from you. We know that Nigeria also has a complex health system, and we just want to learn from you some of those things that you've done, those effective methods or methods that you consider useful for stakeholder engagement. So maybe let's start with Shehu, then Zaya can add.
Okay, yeah, thank you, Dr. Abdul. I will follow the route of my colleague from Ethiopia. Immediately after the first meeting that we had in Ethiopia, on our return back to Nigeria, we debriefed the two leadership, that the Federal Minister of Health and also the ED, MP, CDA. And if you look at the decision made by Zaya, Nigeria as a country, in fact, the Federal Minister of Health is talking about swap, and also the ED, also in his own comment, we listened to him very well, talking about our own strategic blueprints, which align with the CAR's recommendation. So after the briefing of the brief of the two leadership, we map all the partners, donors, and also even the government in campaign ecosystem in the country. And we had our first inaugural meeting where we also presented the CAR's recommendation to them. During this meeting, the partners donors are divided into groups and under the P&I, Mala and financing. And that's how we form the TWG subgroup that come up with the time of reference. And after that, we've had a lot of meeting. TWG meeting every other week, where we also look at the CAR's activities. At the same time, we have also had at least one or two co-creation meeting or workshop, where we allow all the partners also to come up with their own input and see how the CAR's recommendation can be implemented in Nigeria after we have customized into Nigeria content. So in Nigeria, all the stakeholders, the partner donors are also singing integration, which is part of the CAR's recommendation. So I think we are all in alignment now, and I believe we are going to have a very successful CAR's in Nigeria. Thank you, Anuga.
All right, thank you very much, and it's so delightful to hear some of these things that you've done in country, especially customizing these engagement models to country context in the previous year. And I am actually so glad to hear that most of what we've discussed so far are some of those key things that helped us in the previous year. So I just want to hear from you now some of the things that you consider, or what success would look like for you, like that a success with implementing CARS would look like for you in this current year, 2025. So let's continue with you, Shehu, before I go to Lelisa.
Yes, thank you again, Dr. Adamu. As I've said, we have gone a long way in this CAS implementation. If you, I will also repeat again, in my own presentation, I mentioned that first of all, the CAS recommendation is in MPCD strategic blueprint and also in SWAP to ensure, I mean, talking about streamlining of campaign to be more to have a better outcome. So, like this year, apart from that, we are also able to identify both the federal ministry and MPCD priority. All these are also inclusive in the NCAS, which we customize. And recently, just like what I said and my ED said, we had a solution meeting where we also invited all the partners donor. Although this was focused on polio and non-polio, but at the end of the day, our focus is to see how we can also bring about other intervention from federal ministry of health. So I think for the success, well, for the alignment with the partners and donor, everybody talking about CAS now, and also the commitment we have from the both co-chair, that is the ED, MPCD, and also the Director of Public Health from the Federal Ministry of Health. I think for Nigeria as a country, we are good to go because already, as I've said, planning, like for now, we already started planning with the polio and non-polio. As I said, we have the MR campaign this year, and already we are already coordinating on how to see how we can, integrate right from the planning stage. So we have been meeting, and also as I've said, our focus is also at the end of the day to see what we can also bring in from the Federal Ministry of Health. So I think for this year, I'm very hopeful that we are going to start the CAS implementation. Thank you.
All right. Yes, just a little bit follow up there. You're talking in your presentation, and just right now you made reference to how you're integrating the planning now for the MR campaign and even the polio campaigns and so on and so forth. And during your presentation, you mentioned having a calendar for 2025 for all of the campaigns. Now, my question is, in this shrinking donor space, how do you think partners can work differently to enhance campaign effectiveness?
Well, yeah, thank you very much, Dr. Adamu. As I've said, I think we are able to, first of all, to gain the mind of the partners. I mean, in alignment. Because if you look at the SWAP in Nigeria, it's talking about one plan, one country, one budget, and one compensation. Meaning that we need to see how we can look at our budget from various partners. Now that you said the US already are trying to withdrawing some of the money that they support some of these activities. So it's just for us to see that for the little resources we have, we align and we harmonize the budget so that there won't be duplication. So I think I think with that we'll be able to achieve a lot before. And also again, you have to do when you have some money going that you cannot access again. You also have to identify resource mobilization. So you look at how you can also reach out to other donors that will come in to bridge the gap. So I think the major focus on how we can do this about it, because it's as far as funding, it's harmonization of budgets. What we have to support intervention to avoid duplication. Thank you.
All right, thank you so much, Sheo. So I'll go over to back to you, Lelisa. Lelisa, are you still with us?
Yes, I'm here.
Oh, great. Yes. So in 2025, based on your experience so far, in 2025, what does success looks like for you in terms of CAS?
Yes, if we see, I'm sorry for not displaying my slide earlier. If we see our early result, in February 2025, we already start integrating campaigns. We had a polio campaign, which was conducted over 14 million child for polio. So we included 0 dose, and also we included club foot identification. So zero dose, everyone knows that children didn't get access. So when we go for polio house to house, we identified 61,000 child with zero dose, and we vaccinated 61,000 with the polio campaign. Put children, and we brought them to treatment or to health facilities. So we also started a big catch-up campaigns, and in that big catch-up campaign, catch-up vaccination, we included malaria fever test, insecticide treated net distribution for children, also vitamin A supplementation, and people living PLW screening. So we also included fistula in this one, and this has been implemented. We also doing in the polio campaign, so zero dose is included, and now we will have a big measles campaign in front of us, so that will be included. So we consider success for 2025 is so doing the CAS rollout at the regional level, and when we roll out CAS to the regional level, almost we can include vaccination, all vaccination, and other campaigns. At least we can co-deliver if we don't 100%.
Oh, wow, that's really exciting. And might you just share with us some of the things that you're going to do or put in place to improve the efficiency of these campaigns? Or probably your expectations, rather.
Sorry, in between it is disconnected, Abdul.
Okay, sorry. Yes, so I was saying that's a lot of campaigns, and you've hit 2025 on a very good footing with so many activities going on at the moment in country. And you spoke about integrating also at regional level. So I asked, what are some of those things that you are going to put in place to improve efficiency of these campaigns, of these campaigns?
Yeah, to improve the efficiency of the campaigns, I think first we need to start roll out at the regional level. So, and also we have to finalize our implementation guideline. Once we finalize the implementation guideline, that will be our that will be our Bible, or so what our strategy is rolling out CAS to the regional level. So also we need to improve the implementation. We have to finalize our implementation guideline, which will be the guide for all the country. And from our experience, when we do CAS micro planning, so everyone from regions will be part of it. If we all sit and plan together on the micro planning, so the effectiveness will be higher. So it will get more attention as everyone knows about it. So yeah, that will increase the quality.
All right. And yes, so in terms of, I'd just like to ask you a follow-on question. With all of these campaigns going on in country, can you just tell us a little bit about the kind of things that you would want to see changed in terms of financing for these campaigns?
Yes, financing is a challenge, even if without, even before the U.S. budget cut, the U.S. government budget cut. But yeah, sometimes as a government, we have to take some major initiative. So actually, when the budget reduced, bringing campaigns together will be an advantage rather than going piece by piece. So yeah, we are still under discussion on how to cover some of the budget reduction, some of the budget cuts, and as a country, we have also discussed with our prime minister. He requested us to bring some major initiative, which that needs priority so that he can intervene. So that way we will do that. But it does not mean that we don't need budget or money or it won't affect our activity. Yeah, it does, but we will do our best and we are working on it, including the minister and the state ministers.
All right, thank you so much, Lelisa. We are rounding up this panel of discussion now, and I have just one more questions for each of you, which just in 30 seconds, please, just give us an answer. So I just want to hear from you, what is the main challenge that you anticipate for 2025, and how do you plan to address that challenge? In just 30 seconds, please. We're already out of time. Yes, I'll start with you, Lelisa, and then I'll go to Shehu.
Yeah, the main challenge will be the budget. But the budget, we will look for international support, but we have to also look into our treasury or to the internal discussion. So that is what we have planned, and the details we can share because we are working on some compact activities. So trying to bring, even not in the campaigns, but in other like family planning, we are preparing a compact document so that that will be supported by either the government or anyone to step in. So we are preparing some compact documents. We will also do that for we started working that for NTD, for maternal child health activities, and we will also include in that compact document this CAS or this activity.
All right, thank you so much. Yes, thank you. And Shehu, 1 minute, please.
Yeah, thank you, Dr. Damu. I think for us also in Nigeria, there are two: the commodity for the intervention and also the funding. The funding, because for all the intervention, they are getting their commodity or funding from different partners. So are they going to be readily available at the same time? Like for the MR campaign now that we plan for October, already we have this decision letter for vaccine, and also we have Gavi decision letter signed. That is what we have the funding. For if we want to include another intervention, are they going to have the commodity at the same time? So to avoid this is a kind of early planning with what you want to integrate, and also what you want to co-deliver, and also maybe looking inward or outside the box, how you can also mobilize resources in case of any emergency that you want to bring.
Thank you.
Thank you.
Thank you so much. And sorry, Zaya, for not being able to join this discussion for your internet challenges. And thank you so much to the panelists for this insightful discussion. I will now hand over to Alison to complete the Q&A session. Over to you, Alison.
Thank you, Abdu, and thank you, Dr. Lelisa and Dr. Hassan. It's helpful to hear a little bit more of the thinking and reflection from each of your experiences and the teams that you're representing. And yeah, unfortunately, it looks like Zaya's connection was not stable enough to join, but thankfully, Dr. Hassan, we have you as the sole Nigeria representative continuing, so really appreciate that. We have a couple of questions in the Q&A box that we'll turn to now. And thank you for the thoughtful questions from participants so far. We have one, the first question, I'll look to Dr. Hassan, to you directly, because this is specifically about Nigeria and MPH-CDA. So from Charles Obiroha, thank you to the Nigeria team from MPH-CDA. I wish to know further plans to sensitize and involve healthcare workers at the regional and local levels. though I work in a federal teaching hospital in Ebonyi State, I'm open to such collaboration with the agency. So this gets back to kind of the stakeholder engagement and sensitization. I wonder, Dr. Hassan, if you have a response.
Yes, thank you very much. The person that asked the question, yes, in details, all the activities that we have done at the national level, we also have plans to cascade this down to the sub-national level. And it's part of the plan we have to engage stakeholders, more stakeholders at the state or AGA or the world level. So every person that is involved in campaign, they will be briefed and they will be engaged on health campaign effectiveness. As we said even before, after the Ethiopian meeting, we had a feasibility assessment where we also engage or reach out to some of the partners or government that also work in professional level and also work on campaign. So be rest assured, we are going to engage people, whether it's professional level, to also so that they will be competent with what campaign and how to implement it. So thank you very much.
Thank you. In the interest of time, and because we've already heard from Dr. Lilisa on the stakeholder engagement in Ethiopia, I'll move us on to the next question. This is from Rachel Friedrichs. A question for the panel. Can you please describe a concrete and practical change made in one of your health campaigns as a result of the CAS process? Maybe this time, Lilisa, I'll look to you first to respond and then back to Dr. Hassan for a second response.
Going for polio campaign last year, the year before that, or all the years past, when we go for polio, we do only polio campaigns. But now we are able to identify 2,000 clubfoot children who are at their home. So bringing these children for treatment and fixing the clubfoot is one of the practical success. And the other thing is children with zero dose, so bringing them to the vaccine and vaccinating them, and also bringing them to attention of health providers around is one of the practical success. So this will continue. I can say multiple things, but I think this one is enough for the time.
Thank you, Lilisa. Dr. Hassan?
Yes, thank you very much. I will start by saying that the last campaign we had in Nigeria, that is 2024, we had integration. In fact, some states are even administer 3 antigens. Where we had measles, yellow fever, polio. We even, like in Lagos, we even administer HPV for eligible people. So integration is not really new in Nigeria, especially to NPCD. What we are trying to do is just to see some of the recommendation from CAS and see how we can improve it to better the way we do these integration. So it's not really new to NPCD. We have been doing it since 2019, if I could recall. So we have already started talking about integration. And for this year, I've said, as we did last year, we're also going to integrate the micro planning. That from planning stage, everything we want to do together will be done. Will be planned together. We have a template in NPCD that has all the components of all intervention. So it's just for you to identify which one you want to incorporate. Then you can use that template for your planning. So thank you, and over.
Thank you both. And Zaya, I see you've been able to rejoin us. I know you're having some connectivity challenges, but hopefully you can hear us now. I'm actually going to turn to the last question that we have time to answer live. And it's actually 3 questions in one from Bill Ringo. He says that Nigeria says the CAS aligns substantially with their primary healthcare strategy, which is good. Were there existing coordination mechanisms in place that CAS used, or were new mechanisms created? This question also goes to Ethiopia. My second question concerns the development of guidelines for CAS. Did the countries have the same guidelines developed for integrating campaigns and for mainstreaming campaigns into ongoing PHC systems? My last question is about the degree to which CAS has been institutionalized, given the significant political backing it seems to have received in both countries. Any challenges to this effect? So that was a lot, but maybe we'll stay on Nigeria for now. And Zaya, if you're able to come in now, we can start with you around whether there were existing coordination mechanisms in place that were leveraged or new mechanisms created, and then the guidelines for integrating campaign and mainstreaming into PHC.
Okay. Thanks, Alison. Sorry about my network. Yes, so in terms of existing coordination mechanisms, yes, like was mentioned during the presentation, we have a renewed framework for implementation that focuses around saving lives, improving health, and reducing physical and financial pains. And this is what Dr. Hassan spoke about in terms of the one plan, one budget, one conversation. So it's all about getting the right stakeholders in the room to know what is being said at the right time so that we are all speaking, so to speak, the same language. In terms of new strategies, this was actually not new, but rather a platform to accelerate what was already existing and ensure that implementations are being delivered in a more effective and collaborative manner. The political will we're talking about that is in place that we have is that the government of Nigeria endorses this system of one budget for sourcing resources, that's in terms of TA and finances, and ensuring that the right stakeholders know the right information that they need to know to move ahead in terms of implementation and ensuring that the quality of care that we need to get down to the grassroots actually is being delivered. With regards to the guidelines, what we have done is domesticated it to suit the Nigerian ecosystem. So in fact, it's still in the process of being finalized because of two things. There was a health campaign effectiveness workshop that was conducted earlier this year from the NPHCDA space, sort of to look at why aren't campaigns more effective and how we can better integrate. And as we speak, there's a similar initiative being developed for the Ministry of Health side of campaigns. I was talking about NTDs and malaria and the nutrition folks. So once this is done, we already have a draft implementation plan that has been extracted from the from the Nigerian CAS document. We would ensure that all these different outcomes from the two different workshops are integrated into this implementation plan so that it perfectly suits what is the actual business of the day in Nigeria. There's a popular in that we develop perfect systems for a system that is not perfect for our country. So we are trying to address that to ensure that it actually suits perfectly what we are trying to address. Thank you.
Thank you, Zaya. Lalisa, maybe a final word from you as we're wrapping up.
Yes. So as part of integrating into the existing team, now in the existing activity, we are talking about even integrating the campaign. So we don't do the parallel structure. Anything coming to the parallel is not allowed even.
Sorry, Lalisa, your audio cut out. I don't know if you can hear me. Well, if
Hello? Can you hear me?
now we can. Yeah, just maybe if you can wrap up, so we're finishing.
Okay, that's about, sorry about the interruption. So I said we are following one plan, one budget, and one report system. So nothing is parallel. So this cases will be part of our primary healthcare systems, as we always consider primary healthcare system as a backbone of the health system. So it will be in the system. No, there is no parallel one. That is one of the questions. The second one is political commitment. So as we said, there are different arrangements which starts from the steering committee, technical working group. So the steering committee is led by the state minister. So in our arrangement, when we say state minister, it is not like the regional coordinator in other countries. State minister is, we have nationally one minister and three state minister. A state minister which leading this is health service program, he's leading health program and health services. All regions, whatever reportings are coming from him. So politically, it is already accepted, and the minister is on top of it. And then this is also communicated to the government. So politically, everyone is happy with that. So that is where we are heading. That is the only thing I want to say for the sake of time, guys.
Yes, thank you, Dr. Lalisa. And thank you all to our esteemed panelists here, to our moderator, Abdu, to our LT chair, Hamid, and our director, Chris Sarlis, and to all of you for your participation. I feel like we always need more time. Here we are out of time for this 90-minute webinar. But this is just one way to engage with the coalition and to kind of tap into the progress made, the opportunities coming up, and the collaboration and partnership opportunities. So I do hope that you stay in touch, follow up with any of us via email afterwards if we did not address your question, or if something has come up from today's presentation. You likely have some of our contact information, email addresses. You can also always reach out to campaigneffectiveness@taskforce.org, or look at the campaigneffectiveness.org website. We've also provided a link in the chat to something we didn't get to this morning live, but hopefully you're able to look at it on your own time, a package of resources to support the collaborative action strategy. So I really encourage you to take a look at those and be on the lookout for more communications from our team, from the coalition, and more opportunities to engage in the coming weeks and months. I wish you all a good day, a good rest of your day, a good evening or afternoon. Ramadan Mubarak for all who celebrate, and thank you again for your participation this morning. Take care.